Melamed family, welcome back to Don't Let the White Coat Fool You. We are here again, and I'm Dr. Sharon Dixon and
Dr. Norma Mobley, and we are here to talk about some topics that hopefully everybody will be interested in and can relate to.
Yes, and listen, we are excited to be here again with you. And listen, I think Norma has something that's real important to talk about.
So I wanted to talk about medical gaslighting.
Mm-hmm.
Have you heard that term?
I've heard the term.
So typically gaslighting is coined to reflect relationships, like when one partner doubts the ideas or the mental capacity of the other or invalidates the other person's feelings.
Yes.
So medical gaslighting would be the same thing, but in the setting of a provider, a physician doing that with their patients.
Right. And we know that we have heard that happens, especially in communities where there may be a different cultural perspective.
Correct.
Than the one that you're used to.
Right. And the statistics does reflect that patients of color tend to experience this more than those that are not, and also women.
Oh, women, we always catch it.
Okay,
we?
Right?
Yeah.
So let's talk about the specific definition. Medical gaslighting is defined as an act that invalidates, minimizes, or completely dismisses a patient's genuine clinical concern without proper medical evaluation because of the physician's ignorance, implicit bias, or medical paternalism.
And we've heard that so many times when it comes to Black women in particular.
Yeah. So in other words, when a healthcare professional seems to invalidate or ignore the patient's concerns altogether or what you're experiencing. So medical gaslighting can be linked with misdiagnoses, delayed treatment, poor health outcomes. It may even damage someone's trust in the healthcare system altogether because after they have that negative experience, they may decide, if they feel some kind of way, they just won't even go see a doctor at all.
Absolutely. So now, what can we do about that? What do you find is the best way to combat that? So we need to share that with our audience.
So we're going to talk about ways to combat it, but also I want to talk about ways to recognize it, because we as patients, being the consumer of the medical care, may not really be able to recognize gaslighting when it's happening. So let's talk about that first. So number one, a potential cause could be the physician themselves may have poor communication skills. They may not make good eye contact with you. They may not even really touch you during the visit. So they're not able to communicate well with you. The presenting illness may be something that's just not clearly understood, something that may be rare, and because of their lack of knowledge and their arrogance, they may elect not to refer you to someone else that may have that expertise to be able to delve a little bit further and figure out what's going on. The specific illness may not have a specific diagnostic test that can let you know what's going on. So, for example, we have a rapid strep test, swab the throat, and you'll know you have strep. Or you can get a CBC, a complete blood count, and look at whether or not someone is anemic based on their hemoglobin and hematocrit. But all diseases or illnesses don't have one specific test that can definitely diagnose what's going on with you. So that can also lead to a cause for gaslighting. And again, we talked about the conscious or implicit bias.
That's right. You know, it's interesting you should say this. You know, I have a child, and you know that, in New York right now, who just broke their ankle.
Right, bless her heart.
But interesting that the first hospital she went to, there were those kind of things happening.
Really?
The resident didn't really talk, didn't really examine her the way she thought she would be examined. Didn't take into consideration that she had a real phobia when it comes to anesthesia, to pain. And she was really trying to explain that, and his answer was, well, your ankle is broken, so we're going to have to do something about that. But then a whole nother physician came. She said the same things, and that physician said, "Well, we have other ways. We've got some oral medication you can take."
Mm-hmm.
So just knowing that someone, if you speak up
Mm-hmm.
about what you're hearing, and it's not clicking to you that that provider is paying attention to what you're saying, you need to ask somebody else. You need to still speak up about it and know that that's happening.
Right.
So that's interesting.
But how unfortunate is it that we still have to advocate for ourselves just to get what we duly deserve?
Right.
Is good quality health care.
Right. Wow.
Mm-hmm.
That's interesting.
Okay. So key aspects of gaslighting would be dismissive behaviors,
Mm-hmm.
refusal to order tests or even refer to a specialist, and then automatically saying is some sort of psychosomatic attribute. So saying that it's all in your head,
Mm-hmm.
which made me, I'm big on medical history, and so it made me think about back in the days when medical hysteria, or they talked about the roaming uterus
Right.
in women all the way back in like the Greek times, like as far back as Hippocrates.
Mm-hmm.
They actually believed that the ailments that women experience was due to their uterus roaming around.
Mm-hmm.
So I think it's
Yeah.
hysteria
Uh-huh.
is the proper
Hysteria.
Greek word
Right.
for uterus.
Right.
So hysteria and hysterical, the words that we use for coining if someone is losing it,
That's right.
is based
Yeah,
on
thanks for that. I did not
Yes.
know that. That's interesting.
yes. So they used to think that the uterus was a semi-autonomous organ in the body that could roam around, and they felt that it would dry up if you didn't get certain activity, and the uterus was roaming around the body trying to receive moisture. So
Lord.
the ways that they used to try to treat it back then was either give you something foul to smell at the nose to move it away, because they said women who were coughing a lot or fainting, it was due to their uterus moving up too close to their throat.
Wow.
Or
It's
they
amazing
would,
what people will believe.
right, or they will give you sweet smelling things in your vagina to try to draw the uterus back into place. And then they would advise you to marry, and pregnancy was supposed to be a treatment.
And I wonder who put all that together. I'm sure it was
Well,
not a woman.
No, they were all men, of course. So believe this, pelvic massage was also considered a therapy, which later led to, I think it was the mid 1800s, 1869, the first vibrator was developed, and it was made to treat that roaming uterus. But actually stimulating orgasm was supposed to be a treatment.
Wow. Okay.
Okay? And then, believe this though, this is what really got me. This was still, neurotic hysteria was still a diagnosis in the DSM-3 up until 1980. It was just removed.
Wow.
So when you think about that, and you also think about the fact that we as women still experience this far more than men, it kind of dates back historically.
Wow.
Is that crazy?
Well, if you think about also the kind of treatments that were done specifically on Black women
Mm-hmm.
by the man who supposedly discovered gynecology.
Correct.
Just all kinds of procedures done on us without any
Without any anesthesia.
yeah, without anesthesia, without any thought of whether we are in pain, because they just didn't believe we had pain.
Right. Right.
Wow.
And so that still trickles down into the behaviors of what we experience today from the medical community. So to just go into some of the consequences of medical gaslighting again, when your symptoms are wrongly dismissed as a mental issue or related to stressful hormones, then again, your ailment goes undiagnosed.
Right.
The person may go home thinking, well, is this all in my head? Am what I'm feeling really real or not?
Right.
And they may have a condition that is indeed worsening. It could have a terrible outcome.
Well, we certainly don't want that, and it's so important for us to share this kind of information because, knowing the history of it, and then knowing what we're looking at and how to recognize it's so important, and then now what to do about it.
Okay, so what to do about it? So again, let's talk about who's most likely to experience medical gaslighting. Women, people of color, members of the LGBTQ community, and those who are obese.
Huh.
Mm-hmm.
Interesting group.
So how can we address this? Well, one is to go prepared, have a log of your symptoms, and be prepared in writing to be able to communicate this to your provider, and insist that they listen by saying, well, let me repeat this to you again. Did you hear me say
Yes.
X, Y, and Z? And then if you still feel like your needs have not been met, then you can request to be referred to another provider or to a specialist. And if they refuse a test or refuse to refer you, make sure you request that they document this in your records, and then request a copy of your records.
There you go.
To take with you to the next provider.
Yeah.
You can also take a advocate with you, a loved one, your spouse, a dear friend that can go along with you, so that if you yourself feel that power imbalance, you don't feel comfortable saying certain things to a physician, have someone else there with you that might help you feel empowered or can also speak on your behalf.
Well, there you have it, our friends, a way to advocate for yourself. And we've given you quite a bit today, so want to make sure that you keep all of those things in mind as you demand better health care for you and your family.